and welcome to this technical tutorial video. Today we will demonstrate the use of objective gait analysis methods for the assessment of movement asymmetry in the equine patient. We have no conflicts of interest to declare, and informed owner consent was obtained for all animals in this video. Lameness is a common complaint in equine practice and leads to reduced athletic performance, decreased quality of life for the horse, and increased financial burden for the owner. The ability to detect lameness, especially in its early stages, is crucial as it shortens the convalescent period and improves the long-term prognosis. Subjective lameness examination by watching the horse in motion remains the most common method of detecting gait asymmetry. However, this method is not always reliable, and there is often poor agreement between clinicians, especially with cases of mild lameness and cases with hind limb lameness. It's been shown that lameness of grade 1.5 or less on the AAEP grading scale has an inter-observer agreement of only 62%. Young or inexperienced clinicians have also shown reduced inter-observer agreement when compared to experienced lameness clinicians. Expectation bias can also be introduced into the case during perineural or intra-articular analgesia. Objective gait analysis methods have been introduced to alleviate some of the problems encountered with a subjective lameness examination. Two different types of objective gait analysis systems are commercially available for use in the field. These include inertial motions unit systems and single-camera video analysis systems. These objective methods of gait analysis have been validated against multi-camera motion capture systems and have shown high accuracy and precision in quantifying horse locomotion. Their sensitivity is also superior to the human eye. The objective gait analysis systems measure the vertical displacement of the axial body segments while the horse is trotting. This is done by placing sensors or visually tracking movement of the head, pelvis, limbs, and sometimes the withers. At the trot, the horse's head and pelvis will rise and fall twice per stride. The difference in vertical movement between the two peaks and valleys represents asymmetric loading of a limb, with forelimb lameness affecting the vertical movement of the head and hindlimb lameness affecting the vertical movement of the pelvis. This is highly sensitive for single-leg lameness, but can also aid the clinician when a multiple limb lameness is present. There are numerous benefits of an objective gait analysis system to the clinician. Arguably most useful is providing accurate and repeatable data in cases of mild lameness. This improves communication between clinicians and provides visual documentation for the horse owner. Objective data can also be used to compare responses to flexion tests, local analgesia, and at recheck examinations. Unfortunately, some subtle lamenesses are only evident when the horse is being ridden or under specific conditions. Therefore, subjective gait evaluation remains an important part of the lameness examination, with objective analysis systems supplementing the clinician. As previously mentioned, there are two commercially available types of objective gait analysis systems available for use in the field. One type are systems that use inertial measurement units, or IMUs. The IMUs are wireless, sensor-based systems that measure acceleration forces and angular velocities. Depending on the system, 3 to 8 sensors are placed on the pole, sacrum, limb or limbs, and sometimes other parts of the axial body, including the withers and sternum. Systems like the lameness locator use 2 single-axis accelerometers, one on the head and one on the sacrum, and 1 gyroscope on the right forelimb. Because of the 3-sensor configuration, analysis can only be performed at the trot. The resulting analysis shows forelimb and hindlimb lameness separately. On the left-hand side, the forelimb strides are represented by blue rays, with the length of the ray indicative of the amount of total head movement for that stride, and the direction of the ray showing the timing and side of the asymmetry. The mean of all forelimb strides is represented by a red ray. The hindlimb strides are represented on the right-hand side of the analysis as a green or red ray, indicating push-off and impact of each hindlimb stride, respectively. The length of the ray, similar to the forelimb strides, represents the amount of pelvic movement asymmetry for that side. The end of the report provides a trial aid, which details the summary of lameness in that patient. The Equimove system is an example of a more comprehensive system that uses an 8-sensor setup. Other systems include Equigait and Equisim, which can use 3 to 8 sensors or 3 to 7 sensors, respectively, depending on the type of assessment being performed, and the XSens, which uses 6 sensors. The benefits of inertial measurement units are their good repeatability between trials and users, and their consistency in low light or various environmental conditions. Their ability to provide objective changes in vertical head and pelvic movement following flexion tests and local analgesia is also a major asset to the clinician. The disadvantages of the IMU systems are sensor placement can be time-consuming, and a stable wireless connection must be established to collect data. Errors in data collection can occur if sensors are placed in the incorrect orientation or off-center, or if they slide during data collection. A standard deviation of the diff max that is higher than the mean can indicate stride variation that leads to inconsistent analysis and may require repeat evaluation. Medial or lateral deviation of the distal limb sensor by 2 cm has been shown to have little effect on the kinematics. However, incorrect placement of the pelvic sensor lateral to the midline by 2 cm resulted in significant changes to the measured pelvic movement. The lameness locator can identify primary versus compensatory lameness in the trial aid section of the report. It also supports a rider module option that adds a 4th sensor on the rider if the horse is being ridden for gait analysis. The other type of objective gait analysis is camera-based systems. Multi-camera motion capture systems are considered the gold standard in measuring equine locomotion. However, these systems are expensive and restricted to a laboratory setting. An artificial intelligence single-camera markerless system from SLAPE is commercially available. This system uses deep neural networks and computer vision to perform motion analysis from a simple video stream. The AI is trained to track points like the pelvis, head, and hooves, eliminating the need for physical markers. Similar to the equinosis analysis, SLAPE provides an analysis summary that visually describes the asymmetry in pelvic and head movement based on the horse's anatomical dimensions, which are detected by AI. The benefits of the single-camera markerless system is it's fast, portable, inexpensive, and easy to use. Owners can also record videos of their horse at home for analysis using a link provided by their veterinarian. One of the main limitations of this system is it requires more trot-up to gather sufficient data. This is because only body parts that are visible to the camera can be used for analysis. This means that the hind end can't be analyzed when the horse is trotting towards the camera. Additionally, the recording environment requires consistent light and level footing for optimal data collection. The use of a tripod or similar phone stand device can ensure proper video recordings. Similar to the IMU systems, the SLAPE app provides analysis of primary versus compensatory lameness in the analysis summary. The system can also detect whether the horse is being ridden in the recording and evaluates the lameness accordingly. The SLAPE app also records the level of variation in strides. A low level of variation makes the analysis more reliable, and a high level of variation may indicate that a repeat evaluation is required for accurate analysis. Studies have investigated the comparison between these different systems' lameness grades, both when compared only to each other and when compared to subjective lameness evaluation by veterinarians. A 2025 study found that asymmetry can be accurately identified in more severe lamenesses, but may be less sensitive for subtle lamenesses when using IMU technology. However, a study from 2023 showed that IMU technology was precise and highly accurate when quantifying horse locomotion. A different 2025 study compared the difference between different IMU technologies, single camera systems, and subjective lameness evaluations, and found that agreement between all methods was high, although objective measurements were higher than subjective observation. Interestingly, the addition of the wither sensor on the Equisym system did not change the accuracy of lameness identification. A different comparison study between an IMU and single-camera markerless system showed the highest levels of agreement in forelimb movements on a straight line and hard surface. The lowest agreement was seen in pelvic movement on a straight line and soft surface, further highlighting some of the limitations in assessing hind limb asymmetries. On occasion, when performing a lameness evaluation, the need to sedate a horse may arise. When using objective gait analysis, it's important to consider the effect of sedation on movement. Studies have shown that tranquilizers like acepromazine generally do not interfere with gait analysis or alter lameness intensity. However, alpha-2 agonists such as xylazine should be used with caution, as a low dose can mask mild forelimb lameness for up to 60 minutes, though it is generally acceptable for use with hind limb lameness. In conclusion, objective gait analysis provides accurate and repeatable data on the locomotion of a horse. This is an adjunct to a subjective lameness evaluation and can assist the veterinary practitioner in diagnosis and management of the lameness, especially in cases with mild lameness. By quantifying movement asymmetry of the head and pelvis, the clinician's diagnostic confidence can be improved, allowing for better communication with owners and ultimately enhancing the speed and success of treatment plans for equine patients. However, it is imperative to become familiar with your specific system and strictly adhere to the manufacturer's recommendations to ensure accurate results. This concludes our technical tutorial video on objective gait analysis in the equine patient. Thank you for watching.